community foundation was founded based on the principle of serving the Waterloo community. And based on that, we wanted to make sure people who wanted to invest in Waterloo had an entity that they could do that. But beyond that, the board of directors and me as president, we decided that we must go beyond that. We know that one entity cannot serve all the needs of Waterloo. So if we can bring all the nonprofits together, and so you could explore what other nonprofits are doing, then perhaps you can collaborate, or you can serve by sending your clients to them at the needs that you cannot meet in your organization. And so far, we had people planning, we had Together for You, and now we have Mr. Tom Eachus to talk about the Black Hawk County mental health. And I think this is going to be a very, very important one too. Each of them are. But I think with this COVID, I think we're facing mental illness, and sometimes we don't know why we're doing what we're doing, but we fall in that category. And just to know, December 3rd, Bob Fletcher, excuse me, from the food bank will be our presenter. And on that note, I'll turn it over to you, Tom.
Thanks, Will. I think unless Zoom works differently, if everybody makes sure they mute, we won't get the feedback, but there's plenty of time for questions at the end or comments. So thanks for the invitation. I've been around for quite a while. And when Michelle called, I jumped at the opportunity because I love to talk. And hopefully I can provide people with some information. So briefly, Tom Eachus, I'm currently the executive director of Blackhawk Grundy Mental Health Center, which I've been since 1993. And last year, actually back up a little, in 2015, we affiliated with Allen Health System, so we are part of Unity Point Health. And last summer, I became what we call the Behavioral Health Service Line Director, with authority for the mental health unit, their EAP program, and the mental health center here. So that's kind of what I do. If you saw my office, and thank God you can't see my desk, I kill a lot of trees every day. I still provide direct clinical services. I do the majority of presentations in the community because, as Will indicated, COVID has, fortunately or unfortunately, depending on how you want to reframe it, made us busier than we've been in the last 32 years I've been here. So I told everybody, and most people that know me, I'm not real shy. I've been here for 32 years, but I grew up at the place. My dad worked here for 28 years, and so Larry Ryan, our chief psychologist that started here in 1969, I moved him in his office when I was 9 years old. So I've been running these hallways for a long time. So I'm working at a place I always wanted to work. I have a lot of passion and enthusiasm, even though I tend to get older every day. So bear with me. So that's a little bit about me. Let me tell you about the Mental Health Center. Michelle, I lost my slide presentation. Do you
Yeah,
have
I'll put it back.
If you want to go to that first one, the history, I'll assume it's, oh, there you go. So for those of you that don't know, we were established long before President Kennedy's Community Mental Health Centers Act in 1963. Actually, in 1949, there was a group in town called the Social Services Council. Some of you may recall the names Opal Four, Judge Blair Wood. Some of those people were on our first board of directors. And what they did in 1949, think about the time, we had a lot of people coming back from the military that had at the time what was called shell shock. Now we call it PTSD. And there was one private psychiatric clinic in town. But the needs were obviously identified back then, and they've increased now over the last whatever years that is, 80. So we opened our doors for business in 1950 after this first board of directors in 1949 started running around getting donations. Started on a corner office on Washington and 11th, which isn't there anymore. Moved to the community service building in 57, and in 1964, we built our current building, which is on the corner of West 9th Street and St. Francis Drive, on land that we leased from the St. Francis Sisters way back then. About 10, 12 years ago, we purchased the land. So we own the land that our building sits on. The bank still owns part of our building. So bear with it. We put two additions on in 2001 and 2011. I thought in 2011 we would never need any more space in our life, but we've been out of space for 5 years. So anyway, 1964, we began serving Grundy County with the formal affiliation that occurred in 1974, hence our very unique name, Black Hawk Grundy Mental Health Center. We have looked in the last 32 years about changing our name repeatedly to make it a little simpler or maybe a little more catchy, but the community knows us as Black Hawk Grundy Mental Health Center, so if it's not broken, don't fix it. As again, we've been at our current location since 1966. Our building additions in 15, we affiliated with Unity Point primarily because mental health centers in a number of areas of the country are a dying breed. When I started in 1988, there were 43 mental health centers in the state of Iowa. We currently have 19. Many went out of business, some affiliated, some merged with the substance abuse agency. But when you don't have any money or any insurance, or you're unemployed or underemployed and can't pay for mental health services, which is big business in the United States these days, you need someplace to go. So any of you that have paid taxes in Black Hawk or Grundy counties over the last 10, 15, 20, actually, 71 years now, you own a few bricks in our building. So if you want to come out and put your name on them, feel free. Next one, Michelle. We've got a budget of about $5.7 million, of which about 75% are Medicaid revenues. Medicaid consists about 50% of our 6,000 patients, constitutes about 75% of our total revenues. Medicaid expansion in Iowa, in my opinion, has been a very good thing because before that, Black Hawk County taxpayers were paying us about $1.8 million a year out of our $4 million budget. Last year, they gave us less than $200,000 because Medicaid is paying for a lot of stuff. Plus, people have insurance, they can afford medications, they can afford to go to the doctor, whereas before it was problematic in a number of areas. We've got a staff of about 82. Caseload I mentioned, about 6,000 ranging in age from 4 to 84. We see about 1,200 new people every year. And right now, I can tell you in the last 3 months, business has exploded. About 70,000 people that we've served in the Cedar Valley since 1950. We just don't serve Black Hawk and Grundy. We have people driving up here from Des Moines to see a provider or therapist simply because they have a relationship with them. So our catchment area, according to the state, is Black Hawk and Grundy, but we serve anybody from any place, anytime. Revenues I mentioned, I won't badger that one. Our staff, psychiatrist, I'll probably jump ahead with some of my slides, but we are 47th in the United States in having enough psychiatrists. We're 46th in the United States in having enough psychologists. And we are 44th in the United States in having a behavioral health workforce to draw from. I've been advertising for a licensed independent social worker like myself for the last 7 years. I can't find them. And unfortunately, in the United States, although we've been trying to work on it, you cannot bill Medicare unless you have an LISW. Mental health counselors can't do it. So LISWs with our population are extremely important. We've got more nurse practitioners than we have psychiatrists right now, which is great. Allen College has done a wonderful job of training nurses with advanced degrees. They're independent prescribers in the state of Iowa. They don't require supervision, and they've been instrumental in allowing us to increase access and availability of mental health services, which has been in the top 3 community needs assessment surveys from the hospitals and the health department for the last umpteen years. We've got therapists, counselors, social workers, marriage and family therapists. We've got 3 registered nurses that work in our integrated health home program and in our clinic here. We've got certified medical assistants, a lot of bachelor's level folks, which we call care coordinators or community support specialists, which are running around the community trying to work with people with a mental illness. We aren't just an office-based clinic. That makes us a little different as a mental health center. We got into the peer support business in 2006. We lease space down at Commercial and Fifth, the old Iowa Hospice building. We have a mental health recovery center down there run by peers for peers. As I've told everybody for 32 years, I do not know what it's like to be depressed. I do not know what it's like to hear voices. The people that work in that program know what it's like because they are still involved in mental health treatment themselves, but they've had specialized training to help other people in their recovery journey. So peer support is a huge program for us. We have probably 12 peers on our staff, only one full-time, but they've been instrumental in helping us work with people. We have patient service representatives, which are basically support staff, supporting all that we do. The place wouldn't run if you didn't have people like that. And then we've got both an IT and an electronic health records coordinator on our staff. Next one, Michelle. Or Mickey. Oh, Michelle's still here. I thought you were gone, Michelle. In our original mission, Articles of Incorporation back in 1950, consultation and education, consultation to anybody and everybody in town, and education of the community are part of our original mission. I get calls there. This month, I've done more presentations than I can shake a stick at because getting the word out, because one of the things we deal with day in, day out, and have dealt with it for years and years and years is the stigma associated with mental health. We've been trying to reduce that stigma, making it more acceptable to reach out and ask for help. And COVID has pretty much given us a little jump start to doing so, but we continue to provide that to anybody in the community. We primarily provide office-based counseling. At least that's one of the 12 to 15 programs that we offer. People come in, they see their therapist, their counselor, they come in to see their doctor or nurse practitioner to review their medications, and they go home. People don't live here. We're not a residential program. Community support. In 1988, we developed what we call our outreach program, which the federal government calls community support services. I have a staff of 5 people that do nothing other than run around town trying to make sure people with a serious and persistent mental illness can live as independently as possible with their illness, stay out of the hospital, stay out of Tony Thompson's jail, which he's fond of saying he's the biggest mental health provider in the state of Iowa. Corbin may argue with him that the police department is second in line, but I think we ought to be up there in the top 3. We have done a remarkable job at that. When I came to the mental health center in 1988, Blackhawk County was spending $3.2 million a year taking care of that population at MHI and Independence. The state solved some of that problem by reducing the number of beds then at 400 down to 40 now, but people don't go to MHI much anymore simply because, number one, you can't get in, and number 2, we've got community-based programs to take care of them. We also started at the time, we're one of 6 programs in the state of Iowa that provide services to homeless individuals with a mental illness. I've got one full-time person that's been with me since 2001 that visits all the shelters and is a key person in terms of finding housing options for people with mental illnesses. Next one, Michelle. In 1990, we began providing school-based mental health services to the Waterloo schools. In 2014, Cedar Falls joined us. And the reason that's important is if I did my boring statistics, you would hear that 50% of all lifetime cases of mental illness develop by the age of 14, 75% by the age of 25. So add to that most people that develop mental illnesses in our society exhibit symptoms 7 to 10 years before they're even diagnosed. So if half of them develop by age 14, we've got 7 years to intervene early. The schools have recognized that. The schools actually right now are paying us to hire people to provide mental health services in Waterloo and Cedar Falls schools. I have 12 full-time staff members that rotate the schools in Waterloo, trying to serve those kids that are on the tier 3 system, the most difficult to try and keep them in school, because we all know what the consequences of dropping out of school early are. Mental health reentry program, probably about 30 to 40% of our referrals come from the Department of Correctional Services. So we have a full-time staff person down at the men's facility working with people on probation, parole, coming into the community or going to the prison system to try and ease those transitions to make sure people get the services that they need. And again, stay out of Tony's jail. Peer support, I mentioned. We got in the telehealth business in 2011, primarily looked at it with the shortages. And through a number of discussions with our organization, our board of directors, I said, I do not want to be one of the mental health center directors that tells anybody, yeah, I can get you in. I know you're clinically depressed. I know you're thinking about suicide. I can get you in 4 months. I'm not going to be part of that if I can. So we expanded telehealth. Didn't get paid for a lot of what we do, but I have I have as many telehealth providers as I've got on-site providers. And to me, beggars can't be choosy. I would rather increase access and availability some way, somehow, than have massive waiting lists. So I've got telehealth providers from Montana and Florida, a couple from Western Iowa, and the majority of people, unless you have a real serious and persistent mental illness where you have hallucinations and delusions that the TV's talking to you, and it really does in telehealth. Kids like it, adults don't like it. Midwesterns like to reach out and touch somebody, but it's worked for us. Integrated health home. We don't have a house. It's a program to connect people who have serious mental health problems with other providers. Right now, there's still duplication in our system. There's a lot of lack of coordination and communication, which complicates the treatment process. So we have roughly 900 adults and pediatrics with Medicaid that are in our integrated health home, which simply links a care coordinator, a nurse, and a peer support or family support specialist with those individuals to try to coordinate the care that goes on in their life so we can avoid duplication and people being put on the same medication by different providers. And it's helped reduce hospitalizations and improve health outcomes, which is part of the ACA. We have provided mental health services out to Hawkeye Community College in one form or fashion for probably about 10 years. In 2015, we became the sole mental health provider out there through a grant through the Success Link program with Brad McCullough. So I have a full-time person out at Hawkeye Community College. Next one, Michelle. So prior to COVID, we did face-to-face. We did virtual visits since 2011, and with the governor's executive order and with the federal emergency executive order, we can get paid for providing telephonic services to people. And it's expanded again, access and availability. A lot of our clients do not have access to the remote virtual possibilities, and if we can't get them here, at least hooking them up by phone is better than no service whatsoever. So we're continuing to offer all three services. We never closed during COVID. We certainly have moved furniture around and rearranged the deck chairs on the Titanic, but we're doing all the usual precautions from the CDC and Unity Point. But we're still open for business and always have been. April and May, we took a big hit. Everybody was ducking and covering, even people that didn't have mental health problems. But since June, it's absolutely exploded. Last week, we saw 17 new people on one day, where we usually average 5 or 6 a day. So business is booming. Next one, Michelle. General mental health challenges and barriers. I mentioned workforce shortages and I've mentioned the statistics. Our community over the last, hospitals are required by law to do a community health needs assessment every 3 years. I believe the health department does one about the same time. And this past year, they included the United Way and People's Clinic. So it was kind of a true community effort. And in recent years, mental health services, access to and availability have been in the top 3. My goal before I retire in the next 25 years, no, not really, is to make sure that we're probably in the bottom 10, but I'm not sure we're going to get there. We have a significant lack of inpatient psychiatric beds in our state. The number of psychiatric beds across the United States have decreased by 95% over the last 25 years. The national experts said we should have 50 public beds like the MHIs in the Iowa cities, not private hospitals like Mercy One and Allen. They say we should have 50 beds for every 100,000 population. We have 2.1. So it's not uncommon in this state for the sheriff from Council Bluffs to be driving someone up to an open bed that they found in Waterloo on a Friday night or Saturday. And unfortunately, Tony's deputies are driving down to Council Bluffs with a patient that they found a bed for. And that's the craziest system I've ever heard of. 3 years ago, Iowa passed a law that allowed out-of-state providers, Minnesota, Illinois, and Wisconsin, to be paid to hospitalize patients up there. That's not a good thing. Number one, if you get hospitalized in Council Bluffs and you have no way to get home, you got a 2-day bus trip to get back to Waterloo. That's not good for anybody with a serious mental health problem, much less people that don't have family to connect to. So there's still a significant shortage of inpatient psychiatric beds in our state. Everybody should have heard about the social determinants of health. I can tell you, if you don't have food, if you don't have adequate housing, if you don't have adequate medical care, your mental health treatment falls down on the list of maybe 7 or 8. But it should be up there at 1 or 2. So we have a lot of work to do in the social determinants of health. We battle stigma every day. 60% of people in the United States who need mental health treatment aren't getting it, primarily because of the stigma, followed up by lack of insurance, lack of understanding, lack of education, fearfulness, you name it. That's what we've been trying to defeat for many years. COVID is a challenge. We've developed some effective responses to that. Very quickly after the pandemic started, we made sure that every counselor and therapist and community support staff and nurse and even our support staff have the ability to connect with patients or other staff members remotely. So we've all gone to either Zoom or Microsoft Teams. I can hook up 82 people because even Unity Point with their resources don't have cameras and microphones for every computer in their region, but we've successfully got funds to expand that capability. There was one other one I was going to mention in barriers and challenges, but I guess I'll go on. Mental health and COVID. So we never closed. We've expanded our services. We've increased access. The shortage of mental health professionals is really, quite honestly, my current concern. With the numbers increasing, as of this morning, I had 6 staff that have tested positive, and I've got another 6 awaiting the results of their test. While they're able to work from home remotely, if you've talked to anybody or know anybody that's got full-blown COVID, it just zaps the you-know-what out of them. They're tired all the time. They have absolutely no energy. So even if I wanted to chain them to their laptop at home to see patients, they don't have the energy to do that. In fact, one of our staff was hospitalized earlier this week. And when they talk about how quickly these symptoms can put somebody in the hospital, she was tested one day, she was in the hospital the next. So please listen to the experts. They know what they're talking about. So we're more vigilant each and every day about COVID. The pandemic has exacerbated the problems of those with pre-existing mental health conditions, anxiety, depression, grief, loss. That's all expanded. Any of you that have loved ones, my mother and mother-in-law are both at Friendship Village, and for a number of months that was locked down. They at least have the ability, one of them, to connect remotely. But that for elderly folks, and I'm now in that category for the past 3 years, isolation is a bad thing. So we're doing some unique things to reach out to the nursing homes and the long-term care facilities to see if we can get some resources to them. It's also created new problems for many people. The statistics would tell you from the Kaiser Family Foundation that 62% of Americans right now are more anxious at this time this year than they were last year. 52% of Americans feel that their mental health is worse this year than the same time last year. 67% of parents are concerned that their kids are not going to get what they need emotionally and socially in order to continue to grow and develop. and 64% of households with a healthcare worker believe that COVID has had an adverse effect on their entire family functioning. So we've all seen the horror stories on TV. We've actually seen some research, and it was on very shortly after the pandemic with healthcare workers' suicide. So we're extremely concerned and trying to do what we can to meet the needs. The impact of stress on all of us. Everybody's sick of COVID. Everybody was sick of the election, and we're still sick of the election. The unemployment, the lack of contact with family members and loved ones, and unable to attend funerals, all that stuff just magnifies whatever people have pre-existing, and it's been a big concern for us. Next one, Michelle. Opportunities. The entire nation right now is talking about the benefits of expanding telehealth. Unfortunately, if the governor's order, emergency order ends and the federal declaration ends without some type of legislation, my belief is that insurance companies and managed care companies are going to go back very quickly to the only way we will reimburse you is if you see people face to face. Iowa did pass the telehealth parity legislation a year or so ago, but that does not include out of state companies. So, for example, Midland's Choice is an insurance company out of Omaha, Nebraska. They don't have to pay us for telehealth. Right now, we have a number of those insurance companies where prior to COVID, we saw people because it was the right thing to do. But as all of you know, because most of you either volunteer for or have some integral experience with nonprofits, there's something called no money, no mission. So we do the best we can, and we've always tried to do what's right. Alan is talking about, and I don't want to put the cart before the horse because then it usually runs you down and you get up and say what happened. We're looking at opening a mental health walk-in clinic over at Allen to divert people from the emergency department. There's really no mental health services or clinic on the east side of Waterloo, and that's certainly something we want to try and address in the next couple months. COVID has just delayed everything that we've had on the burners. Law enforcement in our community has done a remarkable job of stepping up. Back in 1993, we started training law enforcement officers in crisis intervention training long before all the discussions have taken place in recent years with unfortunate shootings. Tony and prior to the new chief, Dan, were very instrumental in asking us to come in and do training. Cedar Falls as well. Haven't had a chance to meet the new chief yet, so Corbin, twist some arms. I want to get down there and meet him. But there's been trainings supported by our region with the folks from San Antonio, Texas. It's one thing for, law enforcement officers to listen to a mental health geek like me. It's another thing to listen to another law enforcement officer that's been there, done that. So that program and that training is continuing because we don't want an incident like we see across the United States. There's been a Cedar Valley Coalition on Suicide Prevention and Support in our community for the last 4 years. We took over facilitating that committee. We've got about 85 people that meet the second Tuesday of every month at 7 a.m. We're looking at trainings. We're currently doing question, persuade, and refer. It's a 60 to 90 minute long training on how people can get people to help when they may be suicidal. We're looking at expanding, and if anybody hasn't seen it, then you're texting while you're driving. Alive and Running has some billboards in town that rotate. We're looking at using some of the money we got from the community foundation and from our region to do some expanded education and awareness of suicide prevention. Because my big fear with COVID is those numbers are going to increase. The research will tell you in the United States, whenever there's been a downturn in the economy, there's been a corresponding increase in the suicide rate and the substance use. So Chris Hoffman and I at Pathways continue to have our fingers on the pulse of what's going on. We're trying to do some preventative things. There's been a great deal of community interest right now. There's 3 or 4 committees that are working on mental health, just in terms of elevating the discussion, which has been very important for us. Next one, Michelle. We get together every month with all the quote unquote mental health providers in our community that provide traditional mental health just to talk about issues, problems, and quite honestly, the most important part are solutions. That's been a group we meet on the third Thursday of every month at 3:30, and so we're trying to make sure we can do more with less because that seems to be what goes on. Last year, we had our first annual mental health awareness breakfast. We sold the thing out over at the hotel in Cedar Falls. Our plans for this past last month, we were supposed to have our second annual. We were going to do it at the new convention center, and we were hoping to get 1,000 people. That got delayed. We've currently rescheduled it to May, hoping that we'll have some relief from what's going on. But that's an extreme. Last year we had Joan Becker as our keynote. We are currently planning to have the couple from Des Moines who lost their son to suicide a couple years ago, and hoping to reinstitute that just as a way to bring awareness to the community. Okay, I'm done rambling. I'm more interested in listening to other people and answering questions than I am presenting stuff that people may already heard about. So what do you want to know?
Before we get started, once again, this is an opportunity for all of us to learn. Every time I listen to a speaker, the one thing I know that I don't know, but I need to know. There's so many things that each of you are doing in your organization and agency. And Windows on Waterloo is this opportunity for us to dive in, dive deeper. And Tom has agreed to entertain questions. So if you have some, this is the time. And
I'd have to either raise your hand or take yourself off mute and speak because some of you don't have
Oh,
pictures.
both of them.
Hey, Chad, what you got?
How are you, Tom? Thank you so
Good.
much. Great presentation. Sounds like you guys are doing some amazing work there. I'm with Consumer Credit Counseling Service of Northeastern Iowa. I'm actually coming to you all from Rochester, New York, from one of our offices there. And I was just wondering if you see a good percentage of folks who are having, additional mental health issues due to financial stresses that they're running into, whether it be from the COVID crisis or just in general, because that's something we've identified along the way here, that we do see a lot of folks coming to us who, are identifying financial challenges, but it's leading to mental health challenges as well.
Yep. Right now, Chad, since the significant number of our folks are on disability, unfortunately, they haven't discontinued or cut the disability payments. Actually, the folks even on SSI got one of the stimulus checks, which has helped them because, when you're trying to live on $795 a month, and even if you pay 30% of your income on rent and utilities, that still doesn't leave a whole lot. That population has, I think, survived. Our struggles have been, we did pull a lot of our community-based staff back to the office, providing virtual if we could or telephonic contacts with people, but that was a struggle. We had to shut down our recovery center based on the recommendations from Alan for 3 months in March. And those people, we were averaging 25, 35 people a day that would come down there. It's kind of a drop-in program, if you might think, rather than sitting around getting depressed and going to the hospital, you could come down there and get some support. For other people, our big concern right now, and I can't remember, you probably know better than I do, whether the moratorium on evictions has been lifted. That's our big concern. We get about $5,000 every year from our state homeless grant program to help people with rent assistance and rent deposits, and that goes away in about 2 months with the needs that are out here if we're dealing with people with mental illness. I haven't heard a huge uproar from our population about financial stress yet, but you are completely correct. If you were under financial stress before, even with the stimulus check, you're still under financial stress because people aren't making it, and couple that with the lack of jobs. I talked to a lady last week that lost her job, and she's applied for every job possible, and for whatever reason is not finding them, and she's struggling. So yeah, I think the struggles, we're going to see an increase in that as well. What else?
I'm super interested in a lot of the statistics that you
it.
Bye-bye.